this extraordinary meeting of the council. It's 2:30 and it's Wednesday the 1st of July. My name is Councillor Jackie Smith and I'm the chairman of the council. I'd like to welcome you to this extraordinary council meeting, and I'd like to begin by also welcoming all councillors and officers and also those members of the press and the public who are joining our meeting today. And I would like particularly to just point out that all council meetings are available for the general public to come along as well as the press. So any time that you feel you would like to come and see a little bit more of what we're doing, you'll be made very welcome. Last time we met, I expressed the gratitude of the council to the NHS staff for the work that they're doing during this very demanding time and under very difficult circumstances. The comments we made then underline the importance of the health service to our communities and the debate we will be having this afternoon. I would like to thank the members of the public who attended the session earlier today to talk to councillors about their views on Grantham Hospital and the changes that have now been made to the services provided on site. I would like to draw your attention to the fact that the meeting is being recorded for councillors. If you have not already done so, please turn your cameras on now. And to help with the smooth running of the meeting, please can I ask you to turn off any telephone phones or put them onto silent mode, and to remove any possible distractions. If you wish to speak, members should use the chat function and type a comment such as me, speak or next. Members of the public are asked not to use the chat function. If any member of the public does post a comment on the chat box, they will be given a warning. If they post for a second time, they will be removed from the meeting. When invited to speak, you should turn on your microphone, which will have been released for you. Please do your best to remember to mute your microphone once you have finished speaking. Should you forget, we will be able to mute it for you. Members may speak only once, and the length of time for speeches remains 5 minutes. You'll be warned when you have 30 seconds left and when your time is up. Can I also ask that members indicate through the chat function if they are intending to leave the meeting? And thank you all in advance for your cooperation. I will now ask Karen Bradford, the Chief Executive, to confirm the presence of all members and officers who are in attendance at the meeting. When a member doesn't respond to the Chief Executive, she will move on to call the next member. Once the list has been completed, the Chief Executive will recall the names of any member from whom no response was received.
I think I might be in there.
Where there is still no response,
Yes,
that member will be recorded as having not attended.
That's worked, I think. What I can't.
Thank you. Can we just be able to mute Councillor Charmaine Morgan, because we can hear her conversation on the telephone. I think she's got some IT issues, if that's possible. Thank you, Joe. Thank you. Thank you, members. Please bear with us. We don't have a formal recording of attendance system through virtual meetings, so I'll go through the list. Please just confirm present. Councillor Bob Adams.
Present.
Councillor Ashley Baxter.
Present.
Councillor David Bellamy.
Present.
Councillor Harish Barsnell-Singh.
Present.
Councillor Pam Bosworth. Councillor Mrs. Pam Bosworth.
Present.
Councillor Bob Broughton.
Present.
Councillor George Chivers.
Present.
Councillor Louise Clack.
Present.
Councillor Kellum Cook.
Present.
Councillor John Cottier.
Present.
Councillor Helen Crawford.
Present.
Councillor John Dawson.
Present.
Councillor Phil Dilks.
Present.
Councillor Barry Dobson.
Present.
Councillor Mike Exton.
Present.
Councillor Paul Fellows.
Present.
Councillor Helen Gorrell.
Present.
Councillor Breda Griffin.
Present.
Councillor Jan Hansen. Councillor Jan Hansen.
Present.
Thank you. Councillor Graham Gill.
Here.
Councillor Gloria Johnson.
Present.
Councillor Mrs Rosemary Cabery Brown. Councillor, thank you. Councillor Anna Kelly.
Present.
Councillor Phil Knowles. Sorry, Councillor Jane Kingman.
Present.
Councillor Phil Knowles. Philip Knowles.
It doesn't look like Councillor Knowles is fully connected to the meeting, so that's something we'll get IT to look into.
Okay, thank you. Councillor Matthew Lee. Councillor Matthew Lee.
Doesn't look like Councillor Lee is in the session.
Thank you. We've had apologies from Councillor Nikki Manterfield. Councillor Annie Mason.
Present.
Councillor Penny Milnes.
Present.
Councillor Virginia Moran.
Present.
Councillor Charmaine Morgan.
Present.
We've had apologies from Councillor Dr Peter Mosley. Councillor Robert Reid.
Present.
We've had apologies from Councillor Nick Robbins, Councillor Susan Sandel,
Present.
Councillor Ian Selby,
Present.
Councillor Jackie Smith,
Present.
Councillor Lee Steptoe,
Present.
Councillor Judy Stevens, Councillor Judy Stevens.
Present.
Thank you. Councillor Adam Stokes.
Present.
Councillor Ian Stokes.
Present.
Councillor Jill Thomas.
Present.
Councillor Rosemary Trollope Bellew.
Present.
Councillor Sarah Trotter.
Present.
Councillor Dean Ward.
Present.
Councillor Hannah Westrop.
Present.
Councillor Hilary Westrop.
Present.
Councillor Amanda Wheeler. Sorry, we've had apologies from Amanda Wheeler. Councillor Mark Whittington.
Present.
Councillor Jane Wood. Councillor Jane Wood.
Councillor Wood, I've released your microphone. Would you be able to speak for us? We'll make
As we know,
contact with-
Councillor Wood is on the phone. We'll have somebody from IT just contact her to make sure her microphone's working. Councillor Paul Wood.
Yes, present.
Thank you. Councillor Sue Woolley. Councillor Sue Woolley.
Oh, no. No, I got muted, I think.
Councillor Linda Wotton.
Present.
Councillor Ray Wotton.
Present.
Thank you. Can we just check Councillor Sue Woolley if she's on the system, please?
It doesn't look like she's in the call at the moment.
Okay, right, lovely. Thank you. Thank you, Chairman.
Excuse me. Excuse me.
Hello.
Judy Smith. I don't think my name was called out, Karen.
Thank you, Councillor Judy Smith. We've got you there. Thank you.
Have you got me? Jane Wood.
Yes, thank you, Jane. We did see you. Thank you. Thanks for confirming you're with us.
I'll now move on to item 2, disclosures of interest. If any member would like to declare any interest, can you please indicate on the chat function now? Thank you. If during the debate it becomes clear that you have a disclosable pecuniary interest in the matter, you should indicate in the chat box by typing the word interest. I will call on you to disclose that interest, and then you will be required to leave the virtual meeting for the remainder of that item. Thank you. We now return to the main item of business for today's meetings, namely Grantham Hospital. As there was no motion submitted with the request for the meeting, I propose we suspend Council Procedure Rule 4.9.1, motions on notice, to enable members to make propositions from the floor. And I call on the Vice Chairman to second that proposition.
I second it.
Thank you.
Madam Chairman, it's Councillor Mark Whittington here. I have submitted a motion. It was emailed this morning to both yourself and Joe.
We will be
Excuse me, I'm sorry to interrupt as well, but I also, when I originally called for the meeting to be held, I had the motion which we are looking at in Appendix B on the table and was told that we wouldn't be putting forward motions, that we would have an open debate, because otherwise that motion would have been put forward at the beginning. So I'd be extremely concerned if we now accept a late motion, having in effect told me I couldn't submit my motion, or not to submit my motion.
I have also, Madam Chairman, reserved my right to speak first on the debate on the chat function. So I'm happy when I go first to present my motion.
Chairman, thank you for allowing me to come in. This is Shaheen, the Monitoring Officer. This meeting was called as an extraordinary meeting, and as such a paper has been produced, which you have in your agenda pack. That paper has put forward certain recommendations which are very broad, enabling members to come forward with issues they would like to consider putting forward as part of this paper. In that respect, the motion that Councillor Morgan had submitted last time is appended to inform the debate, and what we will now do is to take propositions for motions. There will be opportunities to put forward suggested amendments and to vote on those. The aim is to get to the end of this meeting with a comprehensive motion that is supported. So I just want to reassure members that everybody will be able to put forward their points and have those debated as part of either a motion that's put forward or an amendment to that motion.
Just to put a clarification on that, Shaheen, presumably all these need to be in writing, do they? Any amendments or propositions need to be in writing?
So, Councillor Whittington, we have just voted, or there's just been a proposition and seconded that that particular procedural standing order is amended so that we can take motions not on notice. We have had your proposed motion in writing, but there may be other members who have motions who equally can put them forward, just to make sure that everybody gets their opportunity to put forward what they want to say on this debate.
But just to clarify, they will need to be put in writing.
Councillor Whittington, the chairman has just asked that that particular standing order, Rule 4.9.1, requiring motions in writing, be suspended to enable members to make propositions from the floor. That's been seconded.
But we haven't voted on it yet.
We haven't voted on it yet.
No. Which is why I was making the point before we voted on it. So,
Councillor Whittington, because it's been called as an extraordinary meeting, we don't follow the standing orders for normal meetings. This is a one-item agenda with a report and recommendations, and so we don't have the usual list of motions and public questions and all the rest of it. It is a single-item agenda, but you and any other member will now be able to put forward motions from the floor. Just so that everybody has that same opportunity to propose what they want to say.
That's fine, we can do that. But as I say, I am the first person on that chat function who's reserved the right to speak in the main debate.
That's correct, Councillor Mark Whittington.
Thank you.
Sorry, I just want to be clear though, there is a motion in effect. If you're thinking, Mark, I'm just going to immediately put a motion in, there's a motion already here before us, which is in Appendix B, which could have been submitted as the main motion for debate. But after discussions with Shaheen, we felt it was fairer to everybody if we listened to everybody's arguments. There were a number of key points in my motion already before us, already submitted months ago, because I could see this coming, to be frank. And we felt it would be an appropriate way forward to give everybody a chance to have their say, not leap in at the beginning and say this is my motion, but to form one collectively. That was the argument that was put to me, which I accepted, because otherwise this would be the motion that we would have had. We have already before us, because it was presented. I asked for it to be included in the papers, so there is already something there. This isn't about point scoring, getting in there first with a motion. It's about us all having an open debate and forming one collectively.
I'm not, with respect to Councillor Moore, I'm not trying to point score. I'm just trying to clarify the actual situation. I actually resent the implication that I'm trying to point score. And I would like that to be formally recorded in the minutes, please. Thank you.
You can, but it was also
members of council. Can we refer back to the chairman, please? The chairman has put a proposition forward. It's been seconded by the vice chairman. We do need to vote on that now. If Councillor Whittington would like to bring something forward to the council, he has as much right as any other member of the council to do that. If you therefore wanted a further amendment to that proposal that Councillor Whittington is putting forward, then that can be dealt with as an amendment. Therefore, all members of council have an opportunity to develop or consider or debate that proposal that is put forward to you today. Now, that is, any member of council can add to Councillor Whittington's proposed motion. So, Councillor Morgan, if I can just finish, and if we can now go back to the chairman, for the chairman to take the vote on to proceed to suspend council procedures 4.9.1, then we can move forward and open the debate, all of us, and be able to take part in this very, very important debate on this one issue. Thank you. Councillor Dilks, that you're requesting a point of order. Councillor Dilks.
I wasn't able to unmute. Thank you.
Thank you, Councillor Dilks.
Thank you. My point of order is, if we don't suspend, if we vote not to suspend standing orders, is the motion that is printed in the agenda with the agenda papers that has been circulated, does that fall, or what standing does that motion have? Surely that would seem to be the starting point for today's debate. I do regret that we've got off on this with this tone of debate. I understood that I read the papers. I've been around a few years, and I thought that we would start with that motion, and that any amendments could be taken to that motion. But if we are just going to sort of invite motions, all of us could sort of put one forward, and we're not going to get anywhere. So can I just ask, what happens if we don't suspend the motion? Because what you seem to be saying is that the motion that has been printed doesn't actually have any standing. So why did we print it?
Thank you, Councillor Dilks. The reason that was attached to the documentation, we put that as a background paper because, of course, that was on a previous council meeting that Councillor Morgan proposed, but Councillor Morgan didn't attend that meeting to have that motion considered at that time. So we thought it appropriate to attach it to the paperwork to understand and to assist members in framing a resolution or a motion to put forward to today's meeting. I do hope that we can move on, and that whatever comes forward, and I know this is an extremely emotive situation, and that all members can agree to a final motion where we can all agree on for the next steps. So therefore, I do suggest that we do take that to propose a suspension of the council procedure rules and take a vote on that one now. But that one, what the papers in front of you, Councillor Dilks, are background papers. Therefore, we don't now need to go to the vote. So again, apologies, members, but it is a little laborious, I know, but we do need to take. So it's been seconded and proposed that we suspend Council Procedure Rule 4.9.1 and move forward. Thank you. Councillor Bob Adams.
Councillors should be able to unmute their microphones now.
Yeah, whoops.
Councillor Bob Adams.
Yeah, it is unmuted. I did put a note in the chat function, Chief Executive, to speak. As far as I read these order papers, there is no motion on the agenda. All we have got is background papers. So I don't read the papers at the back in Appendix B or whatever it is as a motion. It isn't actually on the order paper as a motion. But I'm quite happy to support the proposal to suspend that standing order.
Thank you, Councillor Adams. Councillor Ashley Baxter.
Chair, why have we changed the order of voting? Usually we start with the chair and vice chair.
No, we don't.
Councillor Baxter, it's to make the easier. We've only got them one sheet in front of us. We've got an amount of paperwork, so we're using the attendance list to do as a voting list. So thank you for that observation, but that's the way we thought it would be easier to do it today because we'll have a number of votes. So we've done it alphabetically.
Abstain, please.
Thank you, Councillor Baxter. Councillor David Bellamy.
For.
Councillor Harish Bosnell Singh.
For it's Bisnod Singh, please.
Bisnell Singh. Okay, sorry, Councillor Bisnell Singh. Councillor Mrs. Pam Bosworth.
For.
Councillor Bob Broughton. Councillor Bob Broughton.
For.
Councillor George Chivers.
For.
Councillor Louise Clack.
For.
Councillor Callum Cook.
For.
Councillor John Cottier.
For.
Councillor Helen Crawford.
For.
Councillor John Dawson.
For.
Councillor Phil Dilks.
Abstain.
Councillor Barry Dobson.
For.
Councillor Mike Exton.
For.
Councillor Paul Fellows.
For.
Councillor Helen Gorrell.
For.
Councillor Breda Griffin.
For.
Councillor Jan Hansen.
For.
Councillor Graham Deal.
For.
Councillor Gloria Johnson.
For.
Councillor Mrs Rosemary Cabery Brown.
For. Did you hear me? For.
Yes, thank you, Councillor. Councillor Anna Kelly. Councillor Anna Kelly.
Councillor Kelly, your microphone's been released.
Thank you. For.
Thank you. Councillor Jane Kingman.
For.
Councillor Philip Knowles is.
Yes, apologies for joining the meeting late. I was having problems with the machine, but for.
Thank you, Councillor Knowles. Councillor Matthew Lee.
We've confirmed we have Councillor Lee's apologies.
Okay. Councillor Annie Mason.
For.
Councillor Penny Milnes.
For.
Thank you. Councillor Virginia Moran.
For.
Councillor Charmaine Morgan. Councillor Charmaine Morgan.
Abstain.
Councillor Robert Reid.
For.
Councillor Susan Sandal.
For.
Councillor Ian Selby.
For, fellow councillors, so let's get on with this. For.
Councillor Jackie Smith.
For.
Councillor Judy Smith.
For.
Thank you, Mrs Smith. Got you. Councillor Lee Steptoe.
Abstain.
Councillor Judy Stevens.
For.
Councillor Adam Stokes.
For. For.
Councillor Ian Stokes.
For.
Councillor Jill Thomas.
For.
Councillor Rosemary Trollope Bellew.
For.
Councillor Sarah Trotter.
For.
Councillor Dean Ward.
For.
Councillor Hannah Westrop.
For.
Councillor Hilary Westrop.
For.
Councillor Mark Whittington.
For.
Councillor Jane Wood.
For.
Councillor Paul Wood.
For.
Councillor Sue Woolley.
For.
Councillor Linda Wotton.
For.
Councillor Ray Wotton.
For.
Madam Chairman, that vote is carried.
Thank you.
So, thank you for that. Councillor Mark Whittington has indicated first to speak. Thank you. If we can go to Councillor Mark Whittington.
Thank you, Madam Chair. I'm sorry. It was just really just trying to clarify the issues because my motion is a very simple one. It doesn't refer really to anything we might discuss substantively, but it's about the actions to be taken following the meeting. And the motion says, following the emergency meeting of the council calls on the leader of the council, Councillor Callum Cook, to write to Andrew Morgan, Chief Executive of the Trust, John Turner, Chief Officer of the CCG, and Sir Simon Stevens, Chief Executive of NHS England, to express the council's grave concerns that the temporary closure of Grantham Hospital A&E and the loss of medical beds at Grantham Hospital may become permanent from the 31st of March 2020. The second part is then write to Councillor Carl Macy, the Chairman of the Lincolnshire Health Scrutiny Committee, to inform him of the Council's grave concerns that the temporary closure of Grantham Hospital A&E and loss of medical beds at Grantham Hospital may become permanent from the 31st of March 2020. So the reality is that it's just calling on Councillor Cook, following the meeting, on some action points. And the reason why I've chosen the first part of it to write to Andrew Morgan, John Turner and Sir Simon Stevens is because the decision-making process in all of this, these are the three organisations, NHS England, ULHT and Lincolnshire CCG. These are the three decision-making bodies behind any decision that impacts and affects Grantham Hospital. SK, this council, Lincolnshire County Council are not part of this decision-making process. So all we can really do is to express our grave concerns regarding what is happening at Grantham Hospital, because undoubtedly this situation has been going on for far too long. Historically, it really goes back to the late 1990s. Between 1996 and 1998, I actually worked in the finance department of Grantham Hospital, and at the time, it was a small independent hospital. We had a budget of about £25 million. All the senior medical staff, all the senior nursing and the diagnostic staff were local. The board was local. All the decisions were local. We provided a full range of services, A&E, theatres, children's, all the surgical medical departments and directors you could expect in any hospital. The problem started when the decision was taken by the NHS to merge Lincoln, Boston and Grantham into a single trust. Ever since then, there has been a gradual reduction and erosion of services at Grantham Hospital. I mean, we previously, we all know the issue when we lost the paediatric service and the impact that that had on then we lost maternity. The first attempt to take or downgrade Grantham Hospital A&E goes back to 2006. These are long issues. This second attempt to downgrade A&E, beginning in 2016, with the temporary reduction of the overnight service and everything, is couched in these terms, isn't it? Temporary. We see in the recent decision that it's temporary until the 31st of March 2020. The reality is that all of us know it's not temporary. You've just got to look at the downgrading of A&E, the conversion into an urgent treatment centre. That's a key part of the proposed NHS acute services review and healthy conversation. It's very convenient for the Trust Board that they can use COVID-19 and the emergency powers they've been granted as a kind of a smokescreen to actually bring in the changes that they want to do. The issue is, I doubt very much at the end of all of this whether we will get, I suspect this temporary decision will become permanent. They can't complete the consultation process at the present moment of time. The reality is, because the COVID situation trumps that, the reality is, though, there's been no proper consultation up until now.
30 seconds.
Thank you, Joe. It's been consultation in name only. So all my motion does, it's not a point scoring motion at all. It's just to commit the council to instruct Kellum, our leader, to write to these people, the key people who make the decisions expressed in the concerns of this council, that hopefully will come out during the rest of this debate, but also to inform Carl Macy, Councillor Macy, who's the chairman of the English House Scrutiny Committee, as well, so that he's in the loop. So I hope there's nothing in there that members can't support, because it's really just something procedural, a positive action to come out from the debate this afternoon. Thank you very much indeed, Madam Chairman.
Yeah. Have we got anybody to second that
Yes,
proposal?
Chairman, happy to second I'm using Linda's keyboard because mine's not working, but I'll reserve the right to speak later. Thank you.
Councillor Whittington, please, can we clarify whether that should be March 2021?
That is my administrative incompetence, Joe. It should be 2021. I apologise.
Wonderful. We'll get that updated. Thank you very much.
Thank you. Thank you.
Councillor Morgan?
Yes.
Could you please confirm if you are wanting to debate this motion at the present time, or are you looking to put an amendment to this motion?
I actually think Councillor Whittington's motion is a start point.
Yes.
In light of the nature of today's meeting, and I would like to make, if we use it as a start point, I would like to propose amendments to his motion as it is before us. So I'd be willing to. I don't know if I'd say second it, but certainly with amendments, I think it needs more to it, and I'd be happy to explain that. I'm not sure how we do it, whether we treat it as an amendment or whether I couldn't accept it as it is.
Okay, Councillor Morgan, if I can advise, then it was proposed and seconded, and it was seconded by Councillor Ray Wotton. So if you want to put forward an amendment on that, which to bring forward further items as part of the motion, that would be needed to be dealt with as an amendment to the substantive motion.
In that case,
okay.
That's what I'll do.
Okay, but before that, Councillor Penny-Mills did actually, on the chat function, ask to speak in the debate. So if we go to Councillor Penny-Mills, and then we'll come back to you, then you can propose your amendment to the substantive motion. Is that okay?
Yeah, that's fine.
Thank you.
Councillor Penny-Mills, then, please.
Thank you very much. I just want to say something, and then I'd like to ask a question, please. So first of all, I want to say, despite all the problems with the functions that Grantham Hospital should be fulfilling, I'd just like to make a comment on the A&E services desperately needed by local people. Some studies from 2007, reported in the Emergency Medical Journal, have concluded that the average distance from home to an A&E hospital is 8.7k or 5.4 miles, and that a 10k or 6-mile increase, and this is interesting, in a straight line distance is associated with a 1% increase in absolute mortality. Now, albeit this is an old study, it is indicative of the impact of journey time on emergency treatment. And you just take Grantham to Lincoln, that must increase that percentage by at least 3%. Our rural roads, traffic conditions, length of time waiting for an ambulance slow down that response and must therefore increase that mortality figure, and is absolutely unacceptable. My question is, why is Grantham regarded as an appropriate location as a solution to a Lincolnshire-wide problem of COVID-19, unless it is, as feared, a cover for a longer-term decision to close the hospital? And in that context, in view of the proposals we have to increase the population of our district significantly, What alternative options have been considered, and on what grounds were they rejected, and should they be urgently revisited? Thank you.
Councillor Morgan.
Yes, thank you. What I'd like to propose in my amendment is topping and tailing Councillor Whittington's motion, because in effect what he's done is kind of jump to what we could do. And I think that first of all, we need to make a statement, which is what we think we should have as far as local hospital services are concerned. And so the statement being a simplified version in effect of Appendix B would be that we call for the full restoration of Grantham District Hospital with an accident and emergency unit providing full resuscitation and patient stabilisation. So it's a very basic statement, but the fact that it's we're calling for the restoration of a full general district hospital covers all the areas that you would expect such a hospital to have, including the medical unit, children's facilities, everything. So we shouldn't have to list all of the levels underneath that. And then I would like to add at the bottom of the motion that we also write to the Minister for Health, because of course the government actually the Minister for Health sits above NHS England in the decision-making tree, and in fact plays could play quite a key role in this should they decide to intervene. So I believe we are adding to Mark's list of who we write to. I do believe it's extremely important that we write to the Minister for Health. And then tailing that, Mark quite rightly touched upon the fact that originally we had decision-making bodies that were local people and were also elected representatives sitting on those bodies, working in partnership with the health authorities. And the reason we're in this situation, and until it changes, what we now have is a body, and in fact, if you look at it, it's got very few medically qualified people on it. In fact, has a number of executive directors with all sorts of backgrounds, but medical isn't one of them. And they are not accountable, they are not elected. So I would like to add at the bottom the statement that was on my original motion, that we also call for the Health Minister to amend the 2012 Healthcare Act so that in future local authorities have fair representation on the decision-making bodies affecting health services in their communities. And I can't see that that's anything other than a reasonable request that any councillor.
Need to call on someone to second that amendment.
So that's what I would be proposing.
I will second it.
Yeah. I'd like somebody to second that amendment, please. Okay.
That amendment has now been seconded.
I will second that amendment, Karen, please.
Thank you very much.
Yeah, Councillor Dilks, please. I've got that up there. How do I get rid of that?
Yeah, we're all the same.
Thank you, Madam Chairman. I indicated that I wish to put in an amendment. Councillor Morgan has added the amendment. A part of what she said would have been my amendment, which would have simply been to add a third bullet point that says that this council calls on the Secretary of State, and Charmaine perhaps you'd consider changing Minister to Secretary of State for Health, to do what's necessary to reverse the downgrades of Grantham Hospital. It is, I hear what Councillor Whittington said, and of course these local decisions have been made, but overall the bottom line is the person responsible for NHS services in Grantham and everywhere else in this country is the Secretary of State. And the Secretary of State could step in at the stroke of a pen and actually make an order to reverse these damaging cuts that we've seen at Grantham Hospital. That's all I wish to say. Thank you.
I would be happy, I don't know if you can hear, but I'd be happy to accept Councillor Dilt's tweak to my wording, to the amendment.
Thank you, Councillor Morgan. We'll take that. I think
Councillor Cottier. Councillor Cottier.
Councillor Cotty, your mic looks like it's released, so you should be able to speak to us.
Yeah, I was just pointing out that what you had on the screen was not the same as what you actually said. You've actually changed it since then, so it's no problem.
Yeah, Councillor Ashley Baxter.
I've put my question in the chat box, Chair, to save time, but it is, has anybody from the ULHT or the CCG been invited to this meeting to hear our debate? If all we can really do is send a strongly worded letter expressing our concerns, then perhaps those concerns would be listened to more if people were at this meeting to listen. I just wonder if anybody, either officers or members, have invited members of the health community to listen to our deliberations this afternoon.
No, they haven't.
That's a shame.
Who's on now? Councillor Ian Selby.
Councillor Selby, your microphone's been released. Can you try speaking, please?
Councillor Morgan wanted to answer, I didn't she?
members, can I just advise that we're just trying to get Councillor Ian Selby able to speak. Is there a problem with the microphone, Joe?
It's been released, so if he speaks, I'm expecting we should be able to hear him.
Councillor Ian Selby? I think it probably best, Madam Chairman, to come back to Mr. Councillor Ian Selby.
Thank you, Madam Chairman. I think quite a lot of things I was going to say has already been said. I fully agree with the proposition from Councillor Mark Whittington and also Councillor Morgans. What I would like to say, I would formally propose that as on the Appendix 2, another clause that this council's calls for a video consultation room at Grantham Hospital for accessing for remote consultants or appointments remotely. It will save travelling.
Councillor Bisnelth's just proposed an amendment to the amendment that there be a video conferencing room at Grantham Hospital for accessing remote appointments. So either Councillor Morgan will accept that in her amendment, or we'll deal with that later.
Sorry, yeah, my mic's off. Just realised my mic's off. On, I would be happy to accept that. There is a danger of going through every finite piece of service provided at the hospital. But I think actually Harish is making a very good point, and we could tweak the wording so that regarding the provision of the General District Hospital, that which includes appropriate on-site facilities that enable people from across the entire rural community to access services, something like that, which could include video conferencing. So I think that it is a fairly new concept, and it is a very useful service when appropriate. So I would be willing to put that in, or words to that effect.
Thank you, Councillor Morgan. Do we have a seconder for that amendment, please?
Can I second it?
Yes, you can, Councillor Morgan.
Okay, so I'm happy to.
Thank you. Councillor Morgan, you've asked to respond to Councillor Baxter. Is this point of clarification, is it?
Yes, please. Yes, the reason why I know I did consider inviting the trust, and the reason that I didn't raise that or pursue that was because the trust already know all of the arguments. They have been lobbied. They've had people attending their own board meetings, raising questions for years, in fact, and certainly the number of very relevant points raised at the last board meeting when they made the decision to remove the services that they removed. A number of people were at the board meeting when they decided not to reopen the A&E at night, and a number of people at the meeting when they downgraded the board. So, in other words, the board have had plenty of opportunity to listen to the views and concerns of the community. They were given a petition, in total over 80,000 signatures, calling for what we're asking for. So I think our position is very, very clear, and if they don't know it by now, they probably shouldn't be on the board. It would be my response to that.
Right. Are there any further members who would like to speak on the substantive motion and the proposed amendments? Councillor Anne Kelly.
Joe, is Councillor Anne Kelly able to?
Yeah.
Councillor Ray.
Yes. Councillor Ray Wotton.
Thank you, Madam Chairman. Unfortunately, I didn't hear Councillor Charmaine Morgan's proposal, but I have seen the written amendment due to technical difficulties. Madam Chairman, I am proud of the NHS, and I wish to place on record my thanks and appreciation to all its staff for the professional way they have served our community, risking their lives on a daily basis, treating our residents. Madam Chairman, along with colleagues, I have spoken on many occasions about the future of Grantham Hospital, attended rallies, board meetings, debated at County and District Council, delivered a petition to 10 Downing Street along with Councillor Charmaine Morgan, and lobbied our MPs, Dr. Caroline Johnson and Gareth Davis. On the 11th of June, the ULHT board made a decision to implement emergency powers to turn Grantham Hospital into a non-COVID-19 green site as a temporary measure until the 31st of March 2021. Regrettably, the board failed to listen to councillors and campaign groups' concerns. This will mean the closure of A&E, losing medical beds and become a 24/7 urgent treatment centre working alongside ambulatory care. The green site will deal with cancer and urgent elective patients. As someone who had cancer, I fully understand the need that those on the waiting list be treated as soon as possible. Last Thursday, Andrew Morgan, CEO ULHT, reported there were 350 patients on the waiting list in Lincolnshire. Madam Chairman, as you know, Grantham Hospital A&E has been closed temporarily overnight since the 16th of August 2016. Andrew Morgan said the changes at A&E were only temporary. The word temporary has a different meaning to councillors and campaign groups than to ULHT. We have learned from the Clinical Senate that our hospital will never reopen again as an A&E on patient safety grounds, despite recruiting enough middle-grade doctors. Throughout the years of attending board meetings, seeing chairmen and chief executives come and go, many promises have been made that our hospital had a bright future, a bespoke solution, and was going to be a centre of excellence for day surgery. There was even talk 5 years ago from a former CEO, Jane Lewington, that a new building for day surgery where the old hospital stands would be built, but nothing came of it. Andrew Morgan also stated in the past few weeks, we are not looking to downgrade the site. He also said it's not some backdoor way to downgrade Grantham. He also said as well he was not looking to make the downgrade of Grantham A&E unit permanent. So, Madam Chairman, we don't have anything to worry about, do we? We now have an urgent treatment centre, walk-in, or talk and walk as the Trust call it, trying to push patients into phoning up first. I visited the new UTC last week and found only 6 patients waiting. Staff outnumbered patients. I was informed the unit was safe and that patient numbers were improving. It's a shame that staff said they were not allowed to speak out. Madam Chairman, what is the Trust frightened of? Madam Chairman, 4,603 patients per annum who attended Grantham A&E, that's 19% of the total patients, will now be treated at other hospitals. 1,187 will be treated at Lincoln, a hospital that has one of the worst records in England for dealing with patients within the 4-hour period and with waiting ambulances. And they're also in double special measures. 3,424 patients will be treated at other neighbouring trusts. For example, 2,950 are expected to travel to Peterborough. Residents like Mrs S, who contacted me saying she was charged £58 to take a taxi home from Lincoln, money she could not afford. Mrs B, an elderly pensioner who is now expected to have her appointment at Lincoln at 9 in the morning instead of Grantham, and she doesn't drive, so how is she supposed to get there? The Facebook campaign exploded last week with many angry residents who had appointments changed to Lincoln, wondering how they're going to get there and why they could not be treated at Grantham, their local hospital. This council has supported the hospital campaign in the past, which I thank you all. And last Friday, all political parties at County Council
30 seconds.
The motion put forward by Councillor Whittington. We acknowledge the need for cancer patients to be seen and treated as soon as possible, but Grantham Hospital should be reinstated back to its former position on the 1st of April 2021 or before, and hold a public consultation as soon as possible on its future. Finally, listen to our residents. Madam Chairman, the fight goes on. We will not be disheartened. Angry, yes, but not beaten. Thank you, Madam Chairman.
Right. Councillor John Cottier.
sorry, Chairman. I did put a point up on the thing that I asked Joe a question, but it's I didn't want to speak.
Ian Selby.
Thank you, Madam Chairman. Can you hear me okay?
Yes, can hear you fine.
Yeah, thank you kindly. Yes, so apologies about the problems earlier. I just couldn't see the buttons with the with the screen. Anyway, yeah, fellow councillors, we've discussed this many times in the past in the council chamber. The Health Trust, they've systematically ripped our hospital to bits for over 20 years now, and now the latest cuts, they're with no consultation. And they're using COVID-19 as their excuse. I don't know whether you managed to see the joint letter from Gareth Davis and Dr. Caroline Johnson, the open letter to the Chief Executive of the Trust. I thought it was very, very well put together, I have to say. Put party politics to one side of this, read that letter if you get the opportunity. And I would like to read the response that the Health Chief Exec actually sends to those MPs. An important point that they made in that letter was that £342 million in government funding for debt relief write-off has been provided by the government, and I just think that the Health Trust have got something to answer for. Their latest actions are, it's obviously good news for cancer patients. I've actually lost two very good friends in the last week with cancer. I've lost family members with cancer. I've got a family member at the moment who's living with cancer, so I understand the importance of having a good cancer, medical treatment. But what I don't understand is why our hospital cannot be run on a blue and green site when other hospitals are managing to achieve it. And I'll tell you here where the problem lies with this problem that we've been having for many years now. The problem is that there is no mechanism for the removal of unelected bureaucrats. They make decisions, they just do as they like, and they take obscene remunerations in the process, including pensions. Now, let me just tell you, United Lincolnshire Hospital Trust remunerations is in their annual reports, 2017-18, for 9 positions, senior executives, they earned over £1 million. And the pensions, regarding pensions, the chief operating officer, he claimed £207.5 thousand. Unbelievable. 2018-19, over £1 million, £1,100,000. This is a minimum, by the way. The chief exec, he earns £185,000. The deputy earns 142. The director of finance, 140. The estates facilities manager, 105,000. The HR workforce manager, 110,000, medical director, 185,000, nursing director, 126,000, and the chief operating officer, £128,000. Add that up, that's over £1 million. Our MP's salary is 81,000. The Prime Minister, the salary for Prime Minister was 154,000 in 2019. So I'll suggest to you that there's a big problem here with regarding what they actually earn and their accountability. Hence why I liked the amendments that Councillor Morgan's put forward. These people, they're lining their own pockets and filling their pension pots at the same time, and some of the decisions are absolutely they're unbelievable. They really are. We need a full A&E level 1, and yes, let's tell the Secretary of State. We've already told him once. We've already been down there. We've had a delegation down there. We've been to Westminster several times, and everything just falls on deaf ears. We need to find a mechanism to remove these. It needs to be local decisions by local people, and that's what the important point, and I think that's what Councillor Morgan was getting to. But anyway, thank you very much indeed for listening. I'd like to say thank you very much again to the public that spoke in the debates before our meeting. Thank you very much to them. And thank you very much indeed to our NHS staff. They do a fabulous job for them. We love them to bits. Thank you so much. Thank you, Madam Chairman.
Councillor Steptoe.
Yeah, thank you, Madam Chairman.
I want to speak specifically in support of the amendment. Obviously, I totally support what Councillor Whittingham has put forward as the substantive. Of course I do, but I would like to reinforce support for the amendment. Earlier today, we've absolutely heard the passion, the commitment, and the righteous anger from campaigners and members of the public. And like Councillor Selby has just done so, and I'm sure many other councillors have done as well, I'd like to absolutely applaud and salute their efforts over the last years. I was reflecting the other day, for those of us that are Grantham born and bred, as it were, the fight for our hospital is absolutely nothing new. I actually remember marching from the High Street to the hospital in 1988 in support of our hospital when cuts to services were being made then. I was a sprightly 18 years old at the time. But I'm afraid the level of the situation has now reached truly tragic proportions. And again, I'm sure that we can agree on that across this chamber. I think we do need to remember that this has been made possible by the 2012 Health and Social Care Act, simply stating a fact. That act was passed by the Conservative Lib Dem coalition. It was a piece of legislation that was in neither party's manifesto, and yet it absolutely uprooted the NHS as we'd known it for a good couple of decades. It obviously removed local authority representation on trust boards, and it replaced with toothless scrutiny committees. And with everybody, with all due respect to the people doing their best on those county council scrutiny committees, you know, that's a situation that we face. It obviously also opened up the NHS to tender. Some people would argue possible backdoor privatisation, and obviously it effectively gave autonomy to the trust boards. The NHS England, a massive bureaucracy, has effectively replaced the Secretary of State for Health as the overall arbiter, although obviously he makes the ultimate decision. But this is key to understanding the current situation, and that's why this amendment is so important. And quite honestly, if we don't acknowledge that, all we're left with is, despite the best efforts of many people, is impotent hand-wringing. And again, with all due respect to the leader of Lincolnshire County Council, Councillor Martin Hill, when he says that Lincolnshire County Council will ensure that the closure of A&E is temporary, I'm afraid he has no jurisdiction on that matter. And he's obviously a very bright man, and I'm sure that he understands that. So we really shouldn't be misleading anybody. I'd just like to move on quickly to what we actually know, what's going on at the present time. So the Grantham Journal website this morning reports that 175 staff have been moved already from Grantham to Boston or Lincoln. I've spoken to some staff on a purely confidential level. That decision has been made with absolutely minimal input from local managers. There is no longer a fracture clinic in Grantham. There's no physio. There's no Kingfisher paediatric unit. There's no GU clinic. There's no Manthorpe Centre. And as we all know, A&E is basically going to be replaced by a glorified GP's stroke pharmacy, the so-called
30 seconds.
It will also seem that people are being encouraged by the UTC to use 111 under the talk before you walk slogan. Face-to-face assessment will never be beaten. This isn't just about A&E anymore. It's about the future of our hospital and preventing it becoming merely a cottage hospital. So I genuinely hope that we can all come together today as a council and back this perfectly reasonable amendment that doesn't call for the repeal of the 2012 Act. It simply calls for the reform of the 2012 Act to give local councillors more say to scrutinise the board. Local people should know that whatever this council does today is purely symbolic, unfortunately, but I don't think they will forgive us collectively if we don't send out the strongest possible message. Everybody clapping is no longer simply enough. Thank you, Madam Chair.
Thank you.
Thank you. In the chat function, we do have a request to speak of Councillor Charmaine Morgan, but Councillor Charmaine Morgan, you've spoken once in proposing the amendment, and you spoke to clarify on the amendment and seconded the amendment that came forward. Therefore, you've had your opportunity to speak, unless it is a point of clarification. Can you please confirm?
Sorry, I actually wanted to add something further because I thought this was a going process. What we also have realised we haven't got in there is the actual impact of the lack of the General District Hospital and the A&E now. And I was basically adding a statement which I don't think anybody would disagree with, which is that without a fully functioning local district and general hospital with local accident and emergency unit, the cost to the local people is not only financial but also physical, with the risk to their lives increased, their pain, suffering and anxiety extended. And I particularly chose those words because that was the wording pretty much used by the chair of the board when he made the decision to remove all the services, because he was saying to the board that they needed to consider the anxiety and suffering of all of the residents of the rest of Lincolnshire. I would like to, if I may, make one further point, and that's regarding the actual lack of common sense behind what's happened recently. I think this point really needs to be made. By removing the medical department from the hospital, it means that they have no backup during the elective surgery locally. Every elective site where surgery takes place is deliberately located near a district and general hospital, so they have access to the medical team in the event of the patient crashing on the table. Because ULHT, with no notice or proper consultation with the staff, removed the medical wards and most of the medical staff, I've been advised that in fact the numbers of patients they stated that they would be able to deal with has plummeted, and in fact they can only deal with the most simple elective surgery on site, and even that is at a risk. And on the cancer front, I heard
Councillor Morgan, can I just clarify? You've had your 5 minutes on when you put the proposal forward. Then you spoke again on the amendment of a point of order. You've put forward a further amendment now, to which I understand that you wanted to do. What you're saying now is that isn't a further amendment, so we do need to call now for a second.
Sorry, I apologise. I've mixed two things. Right,
yeah,
the further amendment I've given you the wording for.
Yeah.
To add, I don't think anyone would disagree with that. I just feel we're missing the impact if we don't get this. So we're saying we want this, and if we don't get this, this is what will happen, basically.
Thank you,
so
Councillor Morgan.
Madam Chair, Ms. Councillor Whittington, I'd be happy to second that the preamble.
Okay, thank you.
Motion the Councillor Morgan has just, as I said, what I proposed was just a start point, really, just to give us something to focus in on. So I'm happy to support Councillor Morgan's statement before this. Thank you.
Okay, Councillor Cook.
Thank you, Madam Chairman, and thank you everyone for your passionate contributions. Obviously, this transcends party politics and is a matter of great interest to all of us. And I think the desire of all parties to call this meeting and your prompt action in answering that call are clear indications of this Council's dismay at the latest announcements from the United Lincolnshire Hospitals Trust, particularly in relation to the future of Grantham and District Hospital. It also underlines our determination to do all that we can to fight for a healthcare provision that meets the needs of our residents now and for generations to come. And I think I'm sure some of us will have seen further alarm bells are now ringing from this morning following news reported in the Grantham Journal that 175 clinical staff are being redeployed from Grantham Hospital following the temporary changes and downgrading of our A&D. And I think Grantham is growing, and yes, it is a town with challenges, but it is also a town with huge potential. But for that growth, we need the right healthcare infrastructure to support the plans. Nothing less will do. And many colleagues in this meeting today, from all parties, have joined residents on the campaign front line, as well as lobbying behind the scenes to stop the healthcare provision that supports our town and wider district from being downgraded. I'm not going to list names because it is inevitable that I will miss someone and inadvertently cause offence, but I would like to give a special mention to Councillors Ray and Linda Wootton, Mark Whittington, Ian Selby, Adam Stokes and Charmaine Morgan, who have all been particularly forthright in their determination to hold the United Lincolnshire Hospital Trust to account for their actions. I would also like to thank the many campaigners for their continuous commitment to this vital cause. We heard from several campaign representatives during the public session shortly before this meeting, and whilst I don't agree with all of their sentiments, I did understand their feeling. And obviously we organised that to ensure that despite the challenges of virtual meetings, they rightly had a platform and we could hear their views. Before proceeding, I would like to be clear that as a council, we are unanimous on this issue and we are working closely with Lincolnshire County Council so that we have a strong and united voice. The future of Grantham and District Hospital is a passionate issue that transcends party political views, as I've said, and local authority boundaries. It is, therefore, imperative that we have a health service provision that supports our existing and expanding communities and provides the high-quality, accessible healthcare our residents rightly deserve and demand. We need to ensure that our growth is supported by the provision of an appropriate health infrastructure as an integral part of Grantham's expansion and regeneration. And some of the temporary measures given the green light by the Health Trust last month are to be welcomed, namely the return of 24/7 walk-in access to care at Grantham, along with the provision of a specialist cancer care and treatment unit, elective and planned surgery, and the sensible separation areas within the hospital for dealing with COVID. However, I am seriously concerned that these measures, due to remain in place until the 31st of March 2021, do not reflect the current needs nor current demands, and that the restoration plan will have a significant impact on patients throughout Lincolnshire in terms of excessive travel and the downgrading of Grantham A&E. The closure of all medical wards is absolutely not acceptable to any of us. And as some of you will know, I've spoken with our local MPs, Gareth Davies and Caroline Johnson, and their joint letter to the Trust's Chief Executive, Andrew Morgan, has made their position clear. Grantham has their united support, and they will fight tirelessly to protect the future of this town's hospital. I think it's also important to note that the government has also written off £340 million of debt that the Trust had. But we must ensure that we focus our attention and efforts where the decisions will be made, and that is the United Lincolnshire Hospitals Trust. I do support the proposals being brought forward in the main, but we obviously need to have that further debate. And I think I would end that I cannot recall a period in our recent history when the NHS has not been more valued or needed during the last few months. Our health service has always been treasured in this country, but the selflessness and bravery of those who are working day in, day out at the moment in those hospitals, in whatever capacity, has been truly humbling throughout COVID-19. There is nothing more important than good health, and for that we need good health care. And I think, like all of you, I'm not prepared to sit quietly by and allow that provision with our town to slip away silently. And I know that none of us will do that either. Thank you, Madam Chairman.
Yep, Councillor Linda Wootton.
Thank you, Madam Chairman. I thank the District Council for arranging this meeting, as it's important to be having this valuable debate here in Grantham. I have spoken so many times before on this subject. Within ULHT, Grantham Hospital is the lowest denominator, an easy target because of all the services that have been pulled in the past. We, the campaigners, have travelled miles, held ULHT to account at every opportunity, helped deliver a petition of over 60,000 signatures plus to number 10 Downing Street, attended rallies, meetings, jumped through hoops, consulted, had our intelligence insulted, conformed by filling in consultation documents, gone through the STP, HELAC, healthy conversation, and then what happens? The healthy conversation said we want a 24/7 urgent treatment centre. I can assure you, Madam Chairman, we did not. We want 24/7 A&E reinstated and all the facilities we had before. I believe COVID-19 and the delegated powers have allowed ULHT to do what they planned to do all along, downgrade Grantham Hospital. The UTC is run by a community group sourced through the CCG. The Chief Executive of ULHT, Andrew Morgan, said it is a temporary measure, Madam Chairman. He also said we are all cynical and sceptical. I wonder why. Temporary overnight closure of A&E in 2016, and now A&E is gone. I am sad for the dispersed staff of originally 600 down to 200 at our hospital, the loss of beds and services at Grantham Hospital. Grantham Hospital is classified as good, unlike Lincoln and Boston Hospital. I am sad for the people of Grantham and the surrounding areas. We should have the same entitlement to care here locally. How can people afford up to £60 for taxes and so on, and all of the other valid arguments put forward by other campaigners and councillors alike today? I have listened to other campaigners earlier on and can understand they are angry, but I can assure them we are just as frustrated as they are, and we, the local councillors mentioned, are not the enemy. Ray and I have been attending board meetings since 2007 trying to save the midwifery service. In fact, we were pulled in by one chairman and silenced as we were scrutinising the board more than its own members. We feel we are all in it together and stand together, exercise our freedom of speech, regardless of any politics. We, like you, don't trust the trust and are doing all we can. I would like to state we appreciate our wonderful, hard-working NHS staff and we thank them for all they do. Thank you, Madam Chairman.
Councillor Adam Stokes.
Yes, thank you, Chairman. ULHT have done exactly what they intended all along. They have used the COVID legislation as cover to stop any need for consultation, and our residents in Grantham and the surrounding area deserve better. The loss of 72 beds is disgraceful, as I am concerned that these will never return, and the staff on these are left in limbo and are continually moved by the shocking decision making by the trust who, as Councillor Selby eloquently put, are on more than some of the ministers in Parliament. I also understand that this site has been cleared of everything and everyone not deemed essential, so that includes outpatients, children's, maternity. All admin and secretaries have all been moved off site. This points to permanent and not temporary, and we need the answers, and we need to ensure that this is not a permanent change. We need our Grantham Hospital fully functioning. Thank you, Chairman.
Councillor Jan Hansen.
Thank you, Madam Chair. At the risk of sounding vexatious, I'm going to mention this historical underfunding for Lincolnshire again. I've always felt strongly regarding this, and incidentally, still only 3 out of our 7 MPs in Lincolnshire have joined the Rural Fair Share campaign, which is a cross-party campaign group. The root to the problem, in my opinion, is this underfunding. And just to, if I may correct Councillor Ray Wootton, with regards to the green site, it actually states in the ULHT report that it's not for 9 months, it's for at least 9 months. So this could go on for a number of years. And one of my other concerns is to more or less concentrate on the Grantham site. What happens if there are COVID-19 cases in this green site? Already, with regards to diagnosing tests, the government guidelines trying to reach a certain number of tests by 6 weeks, they've gone down in February of this year from 99% to, in April of this year, 37%. So absolutely without a doubt, there are going to be some really sad outcomes as a result of the measures that have been taken locally. And personally speaking, it does seem to have taken quite a time to get to the situation we are in now. When I look at the ULHT reports, I notice at the top, outstanding care personally delivered. Well, we all know the outstanding work that majority, if not all, of the frontline staff have carried out, and it's really commendable. But you know, when you consider the ULHT have been in special measures for 5 to 6 years, I think to state overall that we're receiving outstanding care, you know, has to be questioned. But still, it comes back to this underfunding, because they only have a certain amount of money to spend. And if the government are not giving Lincolnshire its fair share, then they have to bear the brunt of some of the responsibility here. Because, you know, the slate on the debt with ULHT was wiped clean. My concern is that certain local people are going to sit on the laurels. But I really firmly believe that now is the time that SKDC, Lincs County Council, they have to explore every single avenue to receive our fair share of funding that we're entitled to as ratepayers. You know, we've paid into the pot, and we're continuing to be denied fair funding. You know, going by the county council's own figures, you know, over the past 20 years, Lincolnshire as a county, and so the health system really is being shortchanged, but the county as a whole has received something like 2,000 million underfunding. That's using the county council figures. So that's how much money this county has lost out on. One of the problems with Lincolnshire in the health service here, it was explained to me by somebody from London, that because you don't have a fantastic infrastructure, that people, when they're newly qualified, they don't want to come to Lincolnshire to work. You know, when a professional receives their qualifications, they want to go to the best hospitals. The same with legal people. When they get their legal qualifications, they want to go to work for the best firm of lawyers. You know, they don't want to come to somewhere that's understaffed, short of funding, and they can't further their professional career. So, you know, we keep going round in circles here. You know, we can write letters, which that's fine, and you know, certain MPs have written letters, but they're not joining this fair funding scheme, which is a national campaign. So they're not exploring every avenue, in my opinion. You know, we'll keep going round in circles, and maybe in a couple of years' time,
30 seconds.
This green site will carry on for, we'll have got nowhere. So I firmly believe we need to explore every single avenue now and put politics to one side, and the people that are leading this county, in my opinion, need to get their act together, and they're accountable to the public. And we as councillors, elected councillors, we have to make sure we look after the elderly, the sick and most vulnerable. And that, I believe, we need to start immediately. So yes, write letters with regards to this green side, but fight for this fair funding, and we will receive hundreds of millions of pounds over the next few years in funding. Thank you very much, Madam Chairman.
Now, I'd like to thank Councillor Whittington for seconding Councillor Morgan's further amendment. And Judy Stevens, do you wish to speak or would on this?
Actually, thank you, Councillor Smith. I would like to speak because I have sat through many council meetings over the years when we've been discussing this, and I do understand the frustration of the local Grantham councillors in fighting this, and I do applaud their efforts. But I do also hear what Councillor Hanson has just said, and it seems to me that writing yet another letter is quite a, is probably inappropriate in terms of the, well, I would obviously support that, but I think it's, we need sort of bigger action. This is going to not, having a letter from us in the strongest possible terms is not going to make the slightest bit of difference to what happens, in my view. I think we should do it, but yes, I think Councillor Hanson is absolutely right. We should be putting pressure on our local MPs to try and get fairer funding from Lincolnshire. It's simply not right that this isn't happening. It's shocking that this is happening to Grantham Hospital. I think we should be thinking about more direct action. I think we should be spearheading a group within Grantham, which we may, and I may be wrong to say that because it might already be happening, but I think this district council should be leading the fight against this. I think it's absolutely preposterous that it is going on. Frankly, I think if it was happening in Deeping, you'd probably have a riot. And I would like to put my support behind anything that you do to stop this happening. It's wrong, it's unfair, and in this day and age, when we've got a government that are looking to level up, and I believe that they are, this is one way that we can level up. So I'd like us to all put our thinking caps on and think of a better way that we can try and affect this together, because this is completely wrong. And I applaud Councillor Selby and Councillor Hanson for their speeches this afternoon, and also obviously Kellan Cook. Thank you.
Thank you, Councillor Stevens. Would any other members wish to speak? Councillor Rosemary Cabery-Brown.
Yes, thank you, Madam Chairman. I wish to support all of the councillors and all the SKDC Council for bringing this motion to the public and to stand up. Pardon? Hello? Can you hear me?
It's all right. My mic just went flickering. It's better.
Anyway, sorry, I wish to speak, Madam Chairman, because I would like to thank everyone in totally non-party here for bringing this motion to the fore. I wish I could believe that we can do something positive with it. I have served on the Health Scrutiny Committee with Ray Wotton, Mark Whittington and Linda when she stands in for people. Nobody has fought harder. So I am referring to some of the mentions that were people that mentioned earlier in the public meeting that the health scrutiny couldn't do anything. Nobody has worked harder than our SKDC representatives on that committee, of whom I'm one of them. Many a time I have waited in debate deliberately to be the last person to speak, knowing that it obviously has an impression, and also knowing that when we were interviewing the various members of the trust and the various members of the senior hospital staff, and I will admit, on occasion, I've been very rude to them. I've actually said to them, we don't want any more promises. We want A&E open, and we do not want you saying temporary when the definition of it in the encyclopedia is moving something for a short period of time. I have been very forceful. I know a number of our people that were speaking earlier in the public meeting have attended our meetings. But I'm afraid to say, because of the situation at the moment, I think Health Scrutiny Committee, although we've worked very, very hard, seems to have our hands tied behind our backs before we start. We will never, ever let Grantham down. We will fight forever, but it hasn't got us very far so far. Please take it on board that we do seriously work for the people of Grantham and to keep Grantham Hospital open. Thank you.
Thank you, Councillor. I will now call on Councillor Wishington to sum up, please.
Thank you very much indeed, Madam Chairman. I'm really pleased with all of the amendments that have come forward, because as I said right at the start, my original motion was only intended as a starting point, and this has grown and grown. There's some really good, valid and relevant stuff in there. So I'm happy to support all of the amendments to this motion. We're happy for it to go forward as the substantive. We've had councillors mention, Councillor Hanson mentioned the fairer funding for Lincolnshire. There is an all-party parliamentary group that looks at the inequalities in funding, made up by a lot of rural MPs, including some Lincolnshire ones. The County Council and SKDC have been leading a campaign around fair funding, because it is right. Whatever area of the public sector you look at, whether it's funding that comes to council services, funding that goes to the police, funding that goes to the NHS, funding that goes to education, if rural areas live, to use a football analogy, if the big metropolitan boroughs in London are the Premier League, then if you're a county and district council, you're bottom of League Two, desperately fighting to stave off relegation in to the non-league. Lincolnshire, quite simply, is the fourth worst funded county in the country, and it's across the entirety of all the public services. That supposedly we've been waiting for a fairer funding review into local government finance for quite some time. Various issues have come up. Various issues have come along over the time, elections and Brexit. It always seems to be as if it's being pushed forward, pushed on and on. There's always something else that's going to crop up, and I suspect that COVID it will now push that even further into the long grass. The simple fact of the matter is that that does need to be at the forefront of any campaign going forward. It's fairer funding for all public services for Lincolnshire and for all rural counties. As I said, the people of Grantham we've been constantly let down by the local NHS, over the past 20 years. It's shocking news today that all that medical support staff are going. If we're not careful, there's just going to be a burnt out husk on that site instead of anything remotely resembling a hospital. And as I said, 25 years ago when I worked there, it was a fully functioning independent hospital. If you go back and actually look at the research, I'm currently doing some research into Grantham in the Second World War, and at that time the hospital was actually managed and run by a local board in consultation and conjunction with the local councillors. That has to be the model. There has to be a model going forward. There has to be proper representation on there for democratically elected councillors to have their say, because at the moment, as several members have alluded to, it's just a bureaucratic mess. The senior managers come in, for them it's one more step on the career path. There's no real commitment locally. They're told to deliver an agenda by NHS England, and if they don't deliver it, they'll basically find somebody else to go and deliver it. We've had a lot of passion in the debate so far. We've had a lot of passion in the contributions the members of the public made earlier. I've been on health screening committee now at Lincolnshire for a number of years. I have fought tooth and nail with them. In fact, at one point, they took so much exception to what I was trying to say to them that one of the senior managers tried to formally complain about me because I think I was being vigorous in my question of him. I don't think he particularly liked it, because ultimately these people don't like to be held to account. We get nothing but evasion and equivocation from them whenever they appear in front of us on health scrutiny. We write them questions to their trust board. We get non-answers back for the management, full of management speak and technical nonsense. And quite frankly, I think we're all sick and tired of it. I would please ask all councillors to support this motion as it stands before you. I'm completely happy with it. I'm sorry we got off to a bit of a dodgy start, but as I said initially, that was only designed as a starting point. So please, members, please support this, and let's send a strong, unanimous message out to the local NHS and also to NHS England that the people of Grantham and South Kesteven District Council are, quite frankly, Madam Chairman, sick and tired of being pushed around by non-elected bureaucrats. Thank you.
Yeah, okay, thank you very much for that summing up. Yep, I'm just going to ask the Chief Exec to just clarify one or two points. We've had a lot of things going on, so just to make sure that we've got everything in the right order. Chief Exec, will you?
Thank you, Madam Chairman. So the next stage, now that all members have spoken, we've had a proposed substantive motion from Councillor Whittington, which was of 2 points. Then we've had 4 amendments to that, which we are just finalising the wording of those now. As I've not picked up anything in the chat function where people are unhappy or concerned about those amendments, then what I would propose is that we share a screen with the final wording on and the numbering of 1 to 8. So it's a 2 substantive on the motions and the 6 amendments to that original motion, and then call on members to vote en bloc on all of those matters. So members, if you could just bear with us just for a couple of minutes while we just finalise the wording, and then we will share the original motion and the amendments to the motion on screen for you. Thank you.
Oh, it's gone again now. Oh. It's all gone and
No, it's
Hopefully members will be able to see an updated version of the amendment to the motion that was originally presented. The updated version should begin with the word preamble, which is underlined.
Yeah.
Thank you, Joe. Thank you, Joe, for sharing that. So on your screens, members, we've got amendment to the motion, the original motion. We've got the preamble and six amendments there. Six motions there, including the original two plus the 4 amendments. So therefore, unless anybody in the chat function is against this, I propose to take all the amendments to a vote en bloc. I'll just give you 1 minute just to put.
Madam Chairman, I propose that we move to a vote.
Sorry, may I just in the original draft you had, we've lost it. In the preamble, I mentioned that there was risk to life, and we've mentioned the second part of that sentence, but we've somehow lost the risk to life. We've got the cost to local people. I had originally an increase risk to life, and then also financial physical suffering. That somehow that's got lost in it's just the first sentence. I think it's extremely important we make the point people will die because of this.
Yeah, absolutely.
So however you want to phrase it.
Thank you, Councillor Morgan, and thank you, Councillor Whittington. We'll just make that further amendment.
I also second the proposal by Councillor Callum Cook.
Yeah, that's a lot better.
Yeah, it is, isn't it?
Thank you.
Thank you, Madam Chairman. All members now should be able to see the amendment to the motion that is on screen. There's a preamble also including the cost isn't only financial, but the risk to people's life is increased. There's then clear actions for the Leader of the Council, Councillor Callum Cook, and then there is 1 to 6. I propose that we go to the vote as en bloc that was proposed and seconded by Councillor Whittington and Councillor Charmaine Morgan. So if anybody is unhappy with that, could you please let me know now in the chat function? Okay, we'll move forward then to the vote on this this motion and amendments. Councillor Bob Adams.
For.
Councillor Ashley Baxter.
For.
Councillor David Bellamy.
For.
Councillor Harish Bisnausing. My screen's frozen as well.
Councillor Bisnausing, I've just unmuted your microphone.
For. Can you hear me?
Yes, we can now, Councillor. Councillor Mrs. Pam Bosworth.
For.
Councillor Bob Broughton.
For.
Councillor George Chivers.
For.
Councillor Louise Clack.
For.
Councillor Callum Cook.
For.
Councillor John Cottier.
For.
Councillor Helen Crawford.
For.
Councillor John Dawson.
For.
Councillor Phil Dilks.
For.
Councillor Barry Dobson.
For.
Councillor Mike Exton.
For.
Councillor Paul Fellows. Councillor Paul Fellows.
It looks like Councillor Fellows has left the meeting.
Okay, Councillor Helen Gorrell.
For.
Councillor Breda Griffin.
For.
Councillor Jan Hansen.
Great observations. For.
Councillor Graham Gill.
For.
Councillor Gloria Johnson.
For.
Councillor Mrs. Rosemary Cabery Brown.
For.
Councillor Anna Kelly.
Councillor Kelly's left the meeting.
Councillor Jane Kingman.
For.
Councillor Philip Knowles. Councillor Philip Knowles.
For.
Thank you. Councillor Annie Mason.
For.
Councillor Penny Milnes.
For.
Councillor Virginia Moran. Councillor Virginia Moran.
It looks like Councillor Moran is no longer in the meeting either.
Okay, Councillor Charmaine Morgan.
For.
Councillor Robert Reid.
For.
Councillor Susan Sandal.
For.
Councillor Ian Selby.
I lost my connection during the meeting. My apologies for that, but I'm pleased to be able to say for.
Thank you, Councillor Selby. Councillor Jackie Smith. Councillor Mrs. Judy Smith.
For.
Councillor Lee Steptoe.
For.
Councillor Judy Stevens.
For.
Councillor Adam Stokes.
For.
Councillor Ian Stokes.
For.
Councillor Jill Thomas.
For.
Councillor Rosemary Trollope Bellew.
For.
Councillor Sarah Trotter.
For.
Councillor Dean Ward.
For.
Councillor Hannah Westrop.
For.
Councillor Hilary Westrop.
For.
Councillor Mark Whittington.
For.
Councillor Jane Wood.
She's left the meeting.
Councillor Paul Wood.
For.
Councillor Sue Woolley.
For.
Councillor Linda Wotton.
For.
Councillor Ray Wotton.
For.
Thank you, members. Madam Chairman, from the members present here today, that's unanimous.
Hello, Karen. Paul Fellows, Councillor. I lost connection and I would have voted for.
Thank you, Councillor Fellows. We'll note your vote.
Thank you and apologies.
Thank you to everyone.
Yes, thanks everybody. Thank you. Thank you.
That's a powerful message.
Yes, thank you very much.
You're welcome.
Thank you, everybody. Sorry about my screen has frozen, but we don't know why that is happening at the present time. So members have now voted on all of the amendments. That now we should really vote on the substantive motion. But as members have agreed to all the motion, all the amendments that was put forward, can I just ask in the chat function, are all members happy not to go then for a further vote on the substantive motion because it was included in the amended motion?
Yeah. Yes.
Sorry to be so procedural. Thank you. So therefore, Madam Chairman, it is a unanimous vote.
Thank you. And I'd like to thank you all very much indeed for this afternoon. It's been a long day, but I think it's been a very useful day. And let's hope that we can get some action following on from this.
Yeah, I've done that. Yeah.
So I thank everybody for the contributions that you've made today. If we've got any members of the public left, thanks also to them who have been here for a long time. And I hope that we will see some more of them at some of our future meetings. So it now gives me pleasure to declare the meeting closed, and once the recording has been stopped, the session will be ended.